Well, thought we would talk a little bit today about the confluence of these multiple respiratory viruses, particularly COVID, flu, and RSV, and what's behind it a little bit, and what things look like over the next few weeks, which I think is difficult for anybody to predict. But it's clear that the triple threat that we have been talking about for a few months now seems to be coming to fruition, at least in part. So here's where we are with COVID, and I think important to take the current data with a grain of salt, as I think many experts have mentioned. We're not testing at nearly the rate that we have been previously, and although again our case count of 41,000 a day on average nationwide, certainly much lower than the previous surges we had seen in terms of official counts. If you look at things like test positivity, that seems to indicate that our level of community transmission is still relatively high, indeed close to what it's been at previous peaks, where you can see we're about where we were with the Delta wave peak back in the early fall of 2021. And not terribly far behind previous surges we had seen in the winter of 2020, 2021, et cetera. And so that plateau of cases that we've really seen for the past 8 months or so, since March or so, seems to continue. And also, obviously, our number of deaths has really been hovering around 300 or above again since that time, since it came down from the big Omicron BA1 peak. So we're still seeing a lot of COVID in the community, and I think that's bearing out, as Shelley mentioned. We're seeing hospital rates increasing, particularly among the elderly, age 70 and above. The trend seems to be more pronounced in that age group than any other. And I did a very good job of getting people initially vaccinated in that age group, and a decent job getting them boosted. But many of those folks, again, have not received a booster for a year. And so we're seeing increased vulnerability in that age group. We're also seeing hospitalization rates for other age groups creep up a little bit as well. So that's COVID. Now let's look at others. RSV is the second virus that we've been having huge issues with really over the last couple of months. You can see that it appears RSV hospitalizations may be dropping. We'll see if that trend continues. Sometimes it takes a little while to backfill data, but that's good nationwide. Obviously, that we may have hit the peak. There are still regions, I think, within the country that will continue to see very high case rates. And as you can see, in general, RSV season tends to last a long time. The tail tends to be quite drawn out. But I think one thing to note here is just the dramatic difference between hospitalization rates in 2021 and hospitalization rates in 2022. And that is most pronounced, obviously, in kids 0 to 4 years old. And even more so kids under the age of 1. And we'll talk a little bit about that in a couple of slides. Now, compare that to data from the past 2 RSV seasons. And I think this is an important point. So we've had a lot of discussion about this immunity debt phenomenon, where the number of hospitalizations we're seeing now with RSV and flu is being blamed on the fact that we denied kids the right to be exposed to these viruses in the last couple of seasons, and because of that they have low immunity and therefore having more severe disease. But I don't think the data really bear that theory out. So for one, look at the number of cases we had in 2021. We approached the numbers that we're seeing now in terms of overall RSV cases in that season. And if you compare hospitalizations, just going back you can see not even close, right? More than triple, almost 4 times the number of hospitalizations compared to a very slight increase in overall number, right? So that doesn't necessarily make sense, because we had almost no RSV in 2020 when we had the impact, I think, of non-pharmaceutical interventions. So the impact of hospitalizations really should have been in 2021, when we saw this resurgence of RSV similar to normal seasonal levels, but we didn't see those rates of hospitalizations that we're seeing now. Some interesting data from Denmark potentially sheds additional light on this. So it's a little bit hard to follow this graph, but this was put together by this gentleman, Benedict Barkley. And it shows cohorts of kids born at different times. So that bottom bar shows kids, again, that were born in 2020. And so if you were born in 2020, that was your 0 to 12 month year. And you can see there were essentially no hospitalizations for RSV during that year. And again, that's true across most of the world. And then when those kids turned 1 year, so between 12 and 24 months, you can see that their hospitalization rates jumped up, but not to where the seasonal averages typically were. And then if you look, that curve ends at 24 to 36 months, because that's this year. So those kids that were born in 2020 are now in their second or third year of life, right? And you can see their hospitalization rate is higher than it has been, but not what the seasonal average is. So if you think that this is, a phenomenon that's due to immunity debt, those kids would have had the highest debt because they didn't get exposed to any RSV in their first year of life, and now they're getting exposed. But you can see that they're doing better than seasonal average. Where the big jump has been is kids born after 2020. So kids born in 2021, where they had a relatively normal RSV season. And you can see they had hospitalizations much higher than the seasonal average rate. And that's bearing out and continuing this year as well. So now that they're in their second year of life, they are still experiencing much higher rates of hospitalization. And so again, that immunity debt theory doesn't seem to hold water. If you think about kids that were denied their immunity exposure in their first year of life, they should be doing worse if that immunity debt theory is correct. So we'll go back and talk a little bit about the why later, because it's potentially related to flu. So now we're into flu. These are the stats for this year and the past several seasons from CDC, which has excellent flu data visualization. And you can see that we have not only a pretty large influenza season so far, but much earlier than what we typically see. You can see we don't generally hit these types of numbers until right around New Year's. Of what we're seeing now. But you can see again in 2020, that lower graph, we really never saw a pulse of anything in 2020, 2021. That season was, again, the first full year of COVID, where we had non-pharmaceutical interventions and we really had no flu season. Now in 2021, 22, you can see we had a little bit of a flu season, right? We had a peak that was relatively proportionate to what we see with other flu seasons and occurring in the same time frame there. But again, now what you're seeing is a much larger flu season, well, a bit larger flu season than what we saw last year, and certainly much earlier. And what we're seeing now in terms of laboratory confirmed infections is the same. We're seeing an early flu season with a slope that looks like it's approaching kind of normal flu seasons. Now, when you start looking at hospitalization rates, that's where things get even more interesting. So this is a graph of flu hospitalization rates, again, over the last 15 years or so, focusing on age 65 and greater. And you can see that rates vary considerably, but for folks over the age of 65, it generally hovers around 10 to 50 hospitalizations per 100,000 per week when you're at the peak. And this varies depending on the season and particularly the virus. So for older folks, seasons that have an H3 predominant strain, circulating for flu tend to be much worse. Older folks do much better with H1 for reasons we won't necessarily go into, but that's the trend that we've seen over the last couple of decades. And so you can see for age 65, right now, we're around numbers that would be more in line with an H1 year, a relatively mild year for folks under the age of 65, which is unusual because what we're seeing circulating so far is H3. So you can see that again, an average year, maybe a good year, is around 10 hospitalizations per 100,000 per week, and we're below that for age 65. Now look at age 5 to 17, right? These are kids that we don't think of as being generally affected by flu. And as you can see, on average, a bad year for kids is between 2 and 4 per 100,000 per week. And so around tenfold lower than what the bad years are for older adults. But what we're seeing here is one of the worst flu seasons already for kids this age, and numbers that approach what we're seeing with adults now, right? So normally, again, where kids this age have hospitalization rates that are tenfold lower, we're seeing hospitalization rates that are relatively close to what adults are seeing now, maybe half of what the older adults are seeing, in line with what should be seen in an H1 year, right? Because kids generally do worse with H1 compared to H3. The effect is also pretty pronounced in kids age 0 to 4 years old, where again, you can see they're normally around 4 to 6 hospitalizations per 100,000 per week. They're now up around 6. And again, that's right where people over the age of 65 are. So they generally do, again, about 5 or 6-fold better than that older generation. But now they're doing about the same in terms of hospitalizations. Again, looking a lot more like an H1 year versus H3. Now, why is it that kids this year are doing so much worse for H3 than adults over the age of 65, who we usually think of as being the most vulnerable? And why is it happening in an H3 year where that effect is usually reversed? Well, what's one of the biggest differences between adults and kids over the last couple of years? Now, remember, all have experienced those rates of flu where essentially the 2020-2021 year was absent. Last year's flu season had moderate number of cases, as we saw, similar to lots of other seasonal flu. And then this year, we're seeing kind of normal rates of flu just earlier. Well, remember those data we talked about in terms of seroprevalence, right? Kids by far have been infected with COVID more than adults, especially adults over the age of 65. So if you want to look at a theory that actually has some data to support it, it's not this immunity debt theory or any other thing. It's the fact that perhaps some of the immune disruption that we've observed from COVID infection predisposes you to more severe infections from flu and potentially more severe infections from RSV. So if you think about it, that actually makes sense, that we've exposed kids and infected kids with COVID now for several years. So many kids have had multiple infections, and now we're re-challenging them with these other respiratory viruses where perhaps there's an immune window that exists because of their prior exposure and previous infections with COVID-19. Now, this bears out with flu activity in other countries too, and we'll wrap this up quickly. But if you look across Asia, that idea of immunity debt really doesn't seem to hold water as well. So this is data from Hong Kong, and you can see Hong Kong has had essentially no influenza since the beginning of 2020, right? So the end of the 2019-2020 season. So they're now in their third flu season without any influenza activity. So if you were thinking that it's the absence of flu exposure that's made this season so bad, you'd think that Hong Kong should have quite a bit of flu activity going on. The same is these are just additional data for hospital admissions, and you can see it's true for cases and hospitalization. Japan, same deal. We're seeing very, relatively low rates of influenza this year, as we did in 2021 and 2020. And South Korea is the same. Sorry, I didn't put a graph for South Korea. But one of the potential explanations there is, again, The immunity debt thing, probably not significantly important. Also, in many parts of Asia, non-pharmaceutical interventions, while not at the scale that they were a year ago, are still relatively well adhered to on an individual basis. In particular, things like masking in public, where still the vast majority of folks in many Asian countries are wearing face masks when they're in public and crowded spaces. Last thing to talk about is just, again, what the burden of a normal flu season is, and just to emphasize that COVID is not flu. Again, we're all familiar with how significant seasonal influenza is, but I thought this graphic was really helpful, just visually putting the burden of flu on an annual basis out there. And then I kind of superimposed what that first full season of COVID looked like compared to a flu season in rough proportion. And again, really no comparison in terms of cases, hospitalizations, and deaths. If you look at mortality burden, again, looking at those orange arrows there that point to flu-coded mortality versus the shaded COVID mortality curves there on the right, there is obviously no comparison. So flu's bad, but COVID has been so much, much worse. And the last two things to point out, these are a couple of other arguments that people often throw at folks, and so thought there were a couple of helpful tweets that I saw that kind of helped to dispel those myths. So one is this idea that, well, since more people who are vaccinated are ending up in the hospital, and more deaths in the vaccinated than the unvaccinated in some studies, this proves that the vaccines don't work. And I thought this was a great graphic, just kind of illustrating that base rate fallacy, which means that statistics and proportions depend a whole lot on what the underlying rate of any phenomenon is. And so when you look just at people in the hospital, like, again, a lot of people will falsely walk away with the impression that vaccines don't work because we're seeing more vaccinated people in the hospital than unvaccinated. But again, when you have a population, especially a high-risk population that is mostly vaccinated, as in the right there, that Venn diagram shows that even if you have 5 times the rate of hospitalization in the unvaccinated population, if you have so many more vaccinated people, the people who end up in the hospital will still be predominantly vaccinated, even though the vaccine is providing an excellent level of protection. The second thing I think to point out is this was a humorous article published in the British Medical Journal, but they do this every year where they publish kind of humorous but serious studies. And this was a humorous effort by a couple of British researchers to push back on this idea of the randomized controlled trial fallacy. You have people pushing back on that now, that, well, we can't say that masks definitively work because there's never been a randomized controlled trial for masks, never been a randomized controlled trial for, you name it, closing schools or social distancing, et cetera. And this study was looking at doing a meta-analysis, looking at the number of randomized controlled trials that have been done to demonstrate the effectiveness of parachutes, and obviously there are none. And the authors point out that that means that the effectiveness of parachutes has never been proven and subjected to rigorous evaluation. But they do recommend that everybody who cites this argument should be enrolled in a placebo-controlled crossover trial of the parachute, which means that obviously all of them would be subject to the placebo arm. So with that, I will stop and turn it back to you, Shelley.